Hello everyone, I am Dr. Shradha Shejekar. I have done MBBS, MD Psychiatry. I am your psychiatry faculty at Global Healthcare Academy, and today I have brought previous year's questions from NEET PG in psychiatry for you all. Without further any ado, let us begin with our first question. In the mental state examination, 100 minus 7 is equal to 93 is done to examine which of the following mental functions: language, concentration, orientation, judgment. Okay, before we go to the answer, let us understand language is where we assess the reading and writing skills, as we all know. Orientation is where we ask them time, place, person. Judgment, we ask questions such as, what will you do if there is fire in your office and you are caught up inside? So we try to assess whether their judgment is intact or not. Whereas the question here has 100 minus 7 is equal to 93. Usually we ask this kind of a mathematical calculation to be done in their mind. So it's a mental calculation which needs concentration. That is why the answer is concentration. Next, a 46-year-old man is brought to the emergency room by the police after he visited the police station claiming that his daughter was attempting to kill him. Upon investigation, including interviews with family members and neighbors, it was determined that his accusation was baseless. A detailed physical examination revealed no significant abnormalities. What is the most likely diagnosis in this situation? There are certain important terms in this history that the man claims that his daughter was attempting to kill him. That means it is a firm belief. But the police have investigated from the family members and neighbors, and the accusation are baseless. So, according to the other informants, it is all false. So, firm, false, fixed belief means a delusion. The definition of delusion is false, firm, and fixed belief. So, here the answer is delusional disorder. What about Cotard syndrome? Cotard syndrome is also a type of delusional disorder, but here the patient has a feeling that his body parts are rotting like a corpse. His or her body parts are rotting like corpse. So corpse and Cotard, they are mnemonic. Okay. COCO should be the mnemonic to remember. Usually the MCQ will have statements like the patient feels his intestine is rotting or his face is rotting. But in this question, there is nothing of that sort. What about hallucination? Hallucination is a disorder of perception. That means it is not about thinking, but it is more in the audio, visual, tactile, gustatory, all these other kinds of sensations that there will be a alteration. Illusions. The very simple and most common example to suggest illusion is a rope hanging is misinterpreted as a snake. Here, nothing of that sort is given in this question, so even this is not the answer. That is why delusional disorder is the answer, as this patient has false, fixed, and firm belief of the daughter attempting to kill him. Next. A 28-year-old woman is brought to the psychiatric outpatient department by her close friend, who is concerned about her behavior. The patient confidently asserts that her boss is deeply in love with her and has been stalking her. However, her friend strongly denies these claims and insists that they are unfounded. What is the most likely diagnosis in this case? See, here the most important terms are: the woman feels the boss is in love with her. Boss, love, and stalking. So, if a woman feels that a colleague of the higher status or a boss is in love with her and vice versa, if a man believes that the woman of a higher status is in love with him and stalking him, then we have to think about delusion of love. Here, The delusion is established by the fact that the friend denies these claims and they are unfounded. That means she's proving that what this 28-year-old woman is thinking is all false. So they are false and these are firm. Again, delusion, and here the word love has come, boss has come, stalking. So it's the erotomania or delusion of love. Okay. What about delusion of reference? Delusion of reference is when the patient feels that people are talking about him or her, or he or she is being referenced about. Delusion of control means obviously the patient feels him or her to be under the control of external agency. Megalomania is nothing but grandiose ideas or delusions, feeling very high about oneself. Next, a 23-year-old male presents with persistent thoughts of self harm, specifically imagining and planning to cut his fingers, although he has never acted on these thoughts. He reports that these ideas are influenced by his sister, but his mother confirms that he has no sister. Additionally, the patient is observed speaking to someone who is not physically present in the room. What is the most likely underlying cause for this condition? Okay, so here uh, this man claims to be acting on the thoughts influenced by his sister, but there is no sister, as the mother states. That means this 23-year-old male is not in touch with reality. That means there is psychosis. That means there may be schizophrenia also. Okay. Schizophrenia is a type of psychosis. So, out of the four options, first thing that is usually seen in schizophrenia or psychosis is thought insertion. So, we have some gravitation towards thought insertion already. Okay, and moreover, the patient says that he is influenced by his sister. That means he feels these thoughts are being put in him by his sister. So, insertion of thoughts by the sister. That means thought insertion is the answer. Okay. Which of the following is classified as a formal thought disorder? Obsession, derailment, delusion, thought insertion. So, derailment is a type of formal thought disorder. It is characterized by the pattern of speech where the patient is unable to stick to a particular topic and he jumps from one topic to other topic without any logical connection. Okay, so that is why it is a formal thought disorder. Whereas obsession is not about thought, it is not a formal thought disorder. Delusion is about false, fixed, and firm belief. Thought insertion, as we saw in the previous MCQ, it is again a kind of belief or a feeling that someone is inserting thought. Formal thought disorders are specifically elicited by speech. We give certain topic to the patient and they speak on that. And if the flow is not maintained or the topics are being jumped from one to other without any logical connection, then it is called derailment. So, answer is derailment. Which among the following is not a feature of pseudo hallucination? Not under voluntary control, no stimulus required, perceived in objective space, vivid in nature. So, pseudo hallucinations are something that are perceived inside the mind, kind of daydreaming, where you think about the scenarios that make you happy or something. So, it is perceived in subjective space. Pseudo hallucination is seen in subjective, means the subject thinks or perceives the thoughts inside him or her. Okay. Pseudo hallucinations are not under voluntary control, no stimulus required, and they are very clear. You can remember daydreaming. It is not under your voluntary control always, isn't it? Sometimes you just start daydreaming. No stimulus required. As I said, you might just start daydreaming, and they are very clear. Oh, I want to get PG in so and so subject. That kind of vividity. Oh, I am going for the first OPD today, and after getting my PG seat, isn't it? Those are very vivid in nature. Next, a 60-year-old man who lost his wife 3 months ago reports that his intestines feel rotten. He believes he is responsible for his wife's death and should be imprisoned. He experiences persistent low mood and loss of interest in daily activities since her passing. What is the most likely diagnosis? Okay, intestines feel rotten. That means the 60-year-old man is not in touch with reality. How can a man be alive if the intestines were rotting? Isn't it? There would be some kind of physical complaints seen. Okay. There is also mention of persistent low mood, which is a sign of depression. Loss of interest in daily activities. Again, one of the criteria for diagnosing depression. So we got half of our answer, that is depression is definitely there, and intestine feeling rotten, loss of touch with reality, which is nothing but psychosis. So psychotic depression. This is definitely not normal. Though grief is there, the wife has expired, so grief is there, but this is not normal that you imagine that your intestines are rotting and you have persistently low mood and loss of interest in daily activities. Delusional disorder, again, not possible. There is the, see, even if we consider half of the question, there is a delusion maybe, but in the second half, we have persistent low mood and loss of interest in daily activities. So this question has two parts, and we have to look at both of the things to diagnose. That is why delusional disorder is again out of question. Same thing with schizophrenia. The second part is more suggestive of depression. A middle aged man presents to the psychiatry outpatient department reporting that for the past 7 months he has been hearing voices from aliens who command him to kill his relatives. Given the nature of his symptoms and their duration, what is the most likely diagnosis? Command hallucinations, auditory hallucination of command type, are seen in schizophrenia. So there is no second thought only about the answer here. Okay. And also, if you look at the duration, at least 6 months is required. Here we have 7 months. Again, schizophrenia, because duration criteria is met. Hearing voices from aliens, again seen in schizophrenia. It cannot be mania because there is nothing about his mood given in this question. It cannot be brief psychotic disorder because of the duration of 7 months. Delusional disorder, again, here we are already getting auditory hallucinations. So, this is not just about delusion, this is also about hallucination. And delusions and hallucinations both are seen in schizophrenia. A 41-year-old woman presents with a history of experiencing a persistently low mood, reduced interest in previously enjoyable activities, diminished appetite, and significant disturbance in her sleep pattern for the past week. She reports having had two similar episodes in the past 5 years. There is no documented history of symptoms such as periods of elated mood, racing thoughts, or decreased need for sleep. What is the most likely diagnosis? Okay, so 41-year-old woman, persistently low mood, sign of depression, reduced interest in previously enjoyable activities, again suggestive of depression, diminished appetite, sleep pattern disturbed, all suggestive of depression, and duration is at least 1 week is there. She reports having had two similar episodes in the past 5 years. There is no documented history of symptoms such as elated mood, racing thoughts, or decreased need for sleep. Why this is given? To rule out bipolarity. So bipolar, no bipolar, because there is no documentation. When there are frequent episodes happening, it is nothing but recurrent. That is why in the past 5 years, two episodes suggestive recurrent. What about dysthymia? Dysthymia, there will not be any gap between two episodes. It will be a continuous episode for at least 2 years. So that is not there. Cyclothymia, as we already said, there is no documentation of elated mood. So there is no cycling happening of mood. Cycling means alternating between elated and low mood. That is not happening. So again, no cyclothymia. Major depressive disorder, yes, this is a type of major depressive disorder perhaps, but not yet meeting the criteria. But Recurrent depressive disorders also have an episode of major depressive disorder. What I mean to say is, when MDD happens repeatedly, that can be RDD, right? So the answer is recurrent depressive disorder. A woman 3 days after giving birth presents with symptoms including episodes of tearfulness, noticeable mood swings, and occasional difficulty sleeping. Based on her clinical presentation and timing, what is the most likely diagnosis? Okay, just 3 days. The duration is suggestive already, and there are mood changes. So, tearfulness, mood swings, difficulty sleeping, they point towards either depression or blues. There is nothing suggestive of anxiety in this MCQ, no hallucination, no delusion, so no psychosis. Because of the duration, the answer is postpartum blues. It is usually seen within the first 3 to 5 days. A 22-year-old woman visits the clinic with complaints of experiencing sudden episodes of palpitation, profuse sweating, difficulty breathing, and a sensation of being choked. She reports a history of testing positive for COVID 19 a year ago and is now fearful that she might die due to it. These episodes typically last for approximately 20 minutes. This is the first time she has experienced such symptoms. A detailed physical examination, ECG, and lab investigation reveal no significant findings. What is the most likely diagnosis? See, first of all, COVID 19 was a huge stressor for everyone. So, COVID 19 is the stressor, and after that, there are a lot of signs suggestive of anxiety, palpitation, sweating, difficulty breathing, feeling of being choked, which point towards some kind of anxiety disorder. So, depression and bipolar are ruled out because there is nothing suggestive of persistent low mood or mood elevation. What about post traumatic stress disorder? Here, because there is this classical sign of sensation of being choked, this is more suggestive of panic attack. In case of PTSD, they would have given terms like having flashbacks or nightmares about the incident. That is not given in the MCQ. So we can rule out PTSD, and this is a panic attack. Next, a 30-year-old individual presents with a persistent and overwhelming fear specifically triggered by being in or near tall buildings and elevated places. What is the appropriate term used to describe this condition? Agoraphobia, acrophobia, acrophobia, algophobia. See, all these terms appear very confusing, but look at acrophobia and remember acromegaly. You all have heard about acromegaly where the patient has increased height. So, acro means height. Okay. Here we are talking about tall buildings, elevated places. So, again, we are talking about height. So, the answer is acrophobia. Acrophobia, though it sounds very similar, but it is a fear of small bugs, okay, or insects. Agoraphobia is a fear of closed spaces. Algophobia, algo means pain, you know, analgesia, algesia. So, algophobia or algophobia is about pain, right? In analgesia, we have this same term, right? So this is pain. So the answer is somewhere always in your question. You just have to be mindful about them. A 35-year-old woman presents with a complaint of compulsively washing her hands 15 to 20 times a day. She reports that this behavior has significantly affected her performance at work. She attributes this ritual to persistent intrusive thoughts that her hands are contaminated with dirt. Based on the symptoms described, what is the most likely diagnosis for this patient? Washing compulsively. Already half the answer is there. So maybe compulsive disorder. She reports this has affected her work. So her compulsion is affecting her work and it is distressing her. Okay? And persistent, intrusive, contaminating thoughts. All are likely for OCD. There is no description of any kind of hallucination, delusions, or schizophrenia ruled out. No elevated mood or no low mood. So no elevated mood, no mania, no cycling of mood, no bipolar disorder. A 35-year-old female who has sought consultation with multiple plastic surgeons requesting corrective surgery for a perceived facial deformity is referred to a psychiatrist for further evaluation. Despite a thorough examination revealing no physical evidence of a deformity, the patient firmly insists that her face is indeed deformed and requires surgical correction. She continues to demand surgery even after being reassured by both family members and doctors. What is the most appropriate course of action for managing the patient's condition? First of all, we have to know the diagnosis in this case. So, she perceives she has facial deformity. She is going to a plastic surgeon. She has been reassured that she doesn't have the problem, but still she is doing. So, the answer, first of all, is diagnosis is body dysmorphic disorder. Okay. And it is a type of obsessive compulsive disorder. It falls in that spectrum. That is why antipsychotics are out of question, because we are not talking about any kind of psychosis here. And because she is going to the extent of meeting plastic surgeons, and she is insisting firmly, we just cannot handle her with behavioral therapy. We have to do some intervention, and SSRIs are the intervention. Of course, we cannot allow her to go ahead with surgery because everyone is saying that she doesn't have any deformity and they are reassuring. So we just can't comply with what patient wants, isn't it? We have to go with what is right. So SSRIs. A patient with history of chronic alcohol use presents 3 days after abruptly discontinuing alcohol consumption. The patient exhibits symptoms including severe irritability, disorientation, paranoid delusion, agitation, visual hallucinations, and altered sensorium. Based on the clinical presentation, what is the most likely diagnosis in this case? Chronic alcohol use. That means the moment he stops, he is going to go into withdrawal. He stopped already 3 days ago, and that too abruptly, sudden discontinuation, and now we are past 3 days. Irritability, withdrawal is coming in, disorientation, withdrawal is there, delusion, psychosis has come, agitation, withdrawal has come, visual hallucination, again psychotic symptoms have come, altered sensorium, delirium has come. Altered sensorium also means delirium. So there are two things that point towards delirium here. One is the duration. In case of alcohol withdrawal, first day, 1 to 2 days, and more than 2 days. This is how you remember. On the first day, you will have some mild features like tremors, excessive sweating, increased temperature, increased heart rate, increased respiratory rate, and then you also have some hallucinations. Okay, visual, auditory. This is on the first day usually. Between the first and second day, you will get seizures. If at all seizures are to come, they come at this time. And after second day, the person goes into delirium tremens. So delirium tremens is the last. Okay. And altered sensorium, 3 days, both are here. That is why the answer is delirium tremens. What is the most common symptom of cannabis consumption? Out of these options, dreamlike state is the most common symptom of cannabis consumption. Anxiety is not seen. Obviously, if it is making somebody anxious, why would they even consume it in first place, isn't it? Decreased appetite is not seen. Depressed mood is not seen. A patient with a history of chronic alcohol consumption is admitted to the hospital following a road traffic accident. Given the potential risk of alcohol withdrawal symptoms, which medication would be most effective in preventing these symptoms during their hospitalization? Chronic alcohol consumption, that means he's dependent on alcohol, and now after the road traffic accident, when he is in the hospital, definitely alcohol will not be there, so he'll go into withdrawal. So, to prevent alcohol withdrawal, we usually give sedatives, benzodiazepines specifically, and lorazepam is most commonly used. Chlordiazepoxide is also given, diazepam is also given. But amongst these options, the benzodiazepine is lorazepam. And why do we give benzodiazepine? To sedate them, to calm them. Because withdrawal is a kind of excitatory state. As we all know, or perhaps if you don't know, alcohol is a depressant. So when you're chronically consuming alcohol, the brain is in a depressed state. Suddenly the alcohol is removed from the system, it is bound to go into the opposite state of depressed state, that is the excited state. Excited state can present like anxiety or anxiety like symptoms. So to calm these down, we give lorazepam or benzodiazepines. A patient with a long standing history of chronic alcohol consumption is brought to the emergency department presenting with symptoms of confusion, impaired coordination, and pain during eye movements. Clinical examination reveals involvement of the sixth cranial nerve. Based on these findings, what is the most likely diagnosis? Chronic alcohol consumption? Chronic. Okay. There is confusion, there is ataxia, and there is pain during eye movements. Global confusion, ataxia, ophthalmoplegia. So GOA, sorry, the order is wrong, but GOA. You drink alcohol in Goa, so the mnemonic is Goa. If you see GOA features, the answer, no doubt, is Wernicke's encephalopathy, especially when the first line itself is stating that there is chronic alcohol consumption. Okay, you will not see ataxia, pain during eye movements in delirium. Korsakoff psychosis is a later stage and there will be psychotic symptoms also. Declarant is a delusional disorder. So here, that is out of question. Which of the following drug used in ADHD is a selective norepinephrine reuptake inhibitor? Modafinil, methylphenidate, reboxetine, guanfacine. The answer is reboxetine. All of them are used to treat ADHD, but they have asked specifically SNRI. How do you remember whether reboxetine is an SNRI? So if you know other examples of SNRI, duloxetine is an SNRI. And look at this, exetine, right? So it's an SNRI. That's the easiest way to remember. Which among the following dementia presents with Capgras syndrome? First of all, what is Capgras syndrome? Capgras is delusion that a close family member is replaced by someone else. So there is some kind of visual changes also happening here. That means the visual side of it is present. And in Lewy body dementia, usually you see visual hallucinations, Capgras syndrome, or this kind of delusions. Alzheimer's with psychosis, if it is mentioned, then that is a different question. But otherwise, we don't see these kind of symptoms in frontotemporal or vascular or Alzheimer's dementia. We don't see these features. A 28-year-old male presents with a unique pattern of sexual arousal. He reports that in order to feel aroused and engaged in sexual intercourse with a female partner, he requires wearing female lingerie and high heels. He denies any sexual attraction towards males. Based on this presentation, what is the most likely diagnosis for this individual? See, if you get a question where the male is wearing clothes of the opposite gender, the direct answer is fetishism, transvestic type. Okay, you need not even think of anything else. But still, if we want to dissect further, denying any sexual attraction towards males, so no homosexuality, there is nothing mentioned about any kind of physical appearance of his genitalia. So we cannot really comment on testicular feminization. So no hormonal values are given. So we cannot really comment. And of course, gender dysphoria also. There's no specific history. A 32-year-old male presents for psychological evaluation where he is observed to be quite charming and polite, particularly in interactions with family members. However, the patient has a history of frequent altercations with friends and has been involved in multiple police cases. Based on this behavioral pattern, what is the most likely diagnosis for this individual? Antisocial personality and the word charming and polite with frequent altercations. So, if these words are there, the answer is antisocial personality. They are also known as charming personalities, means they try to be charming, but it cannot be long sustained, and then they get into frequent altercations with friends and other people. A patient has been diagnosed with a phobic disorder. Among the various defense mechanisms, which one is the most commonly associated with the manifestation of this condition? Displacement is seen in phobic disorder, where you display some kind of traumatic past events or traumatic childhood memories, and it comes out in the form of phobic disorder. Usually, or in the books, it is though mentioned that a strained relationship with the father can be displaced in the form of a phobic disorder. Lithium usage in pregnancy can lead to which of the following teratogenic effects? So, in lithium usage in pregnancy, we classically see a box-shaped heart, also known as Epstein's anomaly. And it is the heart, so it is the cardiac defect. So, if the mother is using lithium in pregnancy, the baby can have cardiac defects.